Hello everyone, my name is Mokshada Rote. Today we are going to learn hypolipidemic drugs. Hypolipidemic drugs are the class of medications designed to lower the lipid levels in the blood, particularly cholesterol and triglycerides. They play a critical role in managing conditions like hyperlipidemia and reducing the risk of various cardiovascular diseases. Hypolipidemic drugs can be classified into HMG-CoA reductase inhibitors, bile acid sequestrants, lipoprotein lipase activators, lipolysis and triglyceride synthesis inhibitors, and sterol absorption inhibitors. So, we are going to study lipolysis and triglyceride synthesis inhibitors. So, niacin, nicotinic acid is a vitamin known as vitamin B3, and when nicotinic acid is given, triglycerides and VLDL decrease rapidly, followed by a modest fall in LDL cholesterol and total cholesterol. Nicotinic acid is the most effective drug to raise HDL cholesterol. By decreasing the rate of HDL destruction, a 20 to 35% increase is generally obtained. Niacin is also used to reduce lipoprotein A, which is considered more atherogenic. Mechanism of action: nicotinic acid inhibits the intracellular lipolysis by lipases in adipocytes, and it decreases the flow of free fatty acids from adipose tissues to the liver. So, this reduces the availability of free fatty acids for the production of triglycerides and VLDL in the liver. Another mechanism is by reducing the synthesis of apolipoproteins. Uses of nicotinic acid: it is highly efficacious in hypertriglyceridemia, and it is mostly used to lower VLDL and raise HDL levels. Adverse effects are marked flushing, heat, and itching. It occurs after every dose, and dyspepsia is very common. Hyperuricemia and gout and atrial arrhythmias may occur, and there is also increased risk of diabetes mellitus. Some long-term effects are liver dysfunction and jaundice. Myopathy may occur. So, drug interactions: the combination of niacin and statin increases the risk of myopathy. Postural hypertension may occur in patients on antihypertensives when they take nicotinic acid and laropiprant combined with niacin to minimize the flushing. Next, we will see sterol absorption inhibitors. Ezetimibe, it acts by inhibiting intestinal absorption of dietary as well as biliary cholesterol and phytosterols by interfering with specific cholesterol transport protein called as NP-C1L1 in the intestinal mucosa. There is a compensated increase in hepatic cholesterol synthesis. Enhanced cholesterol synthesis can be blocked by statins. The combination of ezetimibe plus lower dose of statin is as effective in lowering the LDL cholesterol as high dose of statin alone. Up to 60% decrease in LDL cholesterol level has been obtained with a combination of simvastatin and ezetimibe. We will see uses of ezetimibe. It is primarily indicated as an adjunct to statin treatment, and it is also indicated to supplement dietary measures when statins are not tolerated. Now we will see adverse effects. There are no specific adverse effects, but reversible hepatic dysfunction may occur, and rarely myositis has been noted. So now we will see the summary guidelines on the use of hypolipidemic drugs. Raised plasma cholesterol is a major risk factor for coronary artery disease and stroke. Prophylactic use of statin in CAD or hypertensive patients, even with average or lower than average cholesterol level, decreases coronary and stroke events. Lifestyle modifications such as low fat, low cholesterol diet, limitation of saturated and trans fat, regular exercise, body weight control, smoking cessation, restriction of alcohol are the primary approaches. All patients who are at the risk of CAD or thrombotic stroke should be put on low-dose aspirin prophylaxis. Now we will see the treatment of high plasma LDL cholesterol. The earlier NCEP 2001 as well as the current American and British guidelines recommend that all subjects who require LDL cholesterol lowering therapy should be treated with statin. Since statin causes a dose-dependent reduction in LDL cholesterol, the current guidelines divided therapy into three categories, which are high density, high intensity, moderate intensity, and low intensity. So in this table, daily doses of statin for high, medium, and low intensity of statin therapy are given. Now this is also the table of indications for high intensity and moderate intensity statin therapy. Now we will see the treatment of low HDL cholesterol level. Most patients with premature CAD have low HDL cholesterol level. The primary approach of therapy is to reduce the LDL-CH by intensive statin therapy. None of the currently available lipid modifying drugs has marked effect to raise HDL cholesterol, but nicotinic acid has the highest efficacy, followed by fibrates. In recent studies, addition of nicotinic acid to statin therapy failed to improve outcome endpoints, while adverse effects also increased. It has been suggested that niacin may benefit if LDL-CH remains high despite statin therapy. Treatment for raised triglyceride levels. So elevated plasma triglyceride has been recognized as an independent risk factor for CAD. Treatment strategy for the hypertriglyceridemia depends upon its severity and upon its cause. So initial drug treatment is to reduce the LDL-CH by statin therapy, and this may itself decrease the plasma TG levels. Patient whose fasting triglyceride remains above 500 mg per dl in spite of above measures run the risk of developing acute pancreatitis, especially after fatty meal or alcohol intake. Now we will see MCQs. So this is first MCQ. The patient with diabetes has hyperlipidemia. Which drug of the following cannot be used in his case due to the risk of development of hyperglycemia? So the options are niacin, statin, cholesterol, and ezetimibe. So our answer is ezetimibe, as we have seen earlier. Next question is, what conditions are worsened with niacin? So the options are gout, cardiac atrial arrhythmias, diabetes, and all of above. So the answer is all of above. This all conditions are worsened with niacin. The drugs which inhibit the absorption of cholesterol is ezetimibe, nicotinic acid, gemfibrozil, or fish oil. So answer is ezetimibe. How can you avoid some of the adverse effects seen with niacin? Like adverse effects like dyspepsia, skin flushing, itching, which occurs after every dose. So options are by taking an NSAID like aspirin concurrently, by taking medications at night, by taking medications with food, or the adverse effect cannot be avoided. So correct answer is by taking NSAIDs like aspirin, we can avoid the adverse effects like dyspepsia, skin flushing, and itching. So last one, which drug is used to treat hyperlipidemia? Acts by inhibiting the mobilization of free fatty acid from peripheral adipose tissues to the liver. Options are statins, fibric acids, niacin, or bile acid binding resins. So answer is C option, niacin, which is nicotinic acid. Thank you.